We were told that Medicare Advantage could not be sold on the phone at all. Guys, the other day I was talking to my team. It was right at the beginning of AEP, and I was trying to create a little bit of perspective. In the industry, a lot we hear feedback from people about, this tech tool not working appropriately, this kind of thing, and at the expense of sounding like I'm saying, hey, I walked 6 miles in the snow barefooted uphill, and being that guy, I do want to just talk about a little bit of the history of how Medicare sales worked over just the last 10 to 15 years. And before that could be even different. Like we could go all the way back to when Medicare supplements were the primary thing sold in the Medicare world before there were really any Medicare Advantage plans, and the supplements paid double commission first year, so people were rewriting them. There was no standardization for a long time, all of those things. But I'm just going to talk about the last decade. 2014, when I really started selling at the beginning of that year, going into that AEP, we were told that Medicare Advantage could not be sold on the phone at all. Most people in those years had to be a CMS certified call center, which was, quite a hurdle to get over to actually sell Medicare Advantage over the phone. So Medicare Advantage, for the most part then, was sold either door to door or face to face in an office. Or if it was sold over the phone, like a drug plan or Medicare Advantage, if that was happening, you still had to mail the application to them for physical signatures. Now imagine when you have to present the plan and talk about a plan, this is pre-recording requirements, et cetera, and you have to mail an entire physical application with sign here stickers, with return postage, return envelopes, automatically ready, and let's say it's December 1st and someone calls you and you have to do that. When you go to do that, what if it doesn't come back before December 7th, December 8th, December 9th? Boom, I can't get that application in. So much more confined, a lot of analog processes. At the same time, when it does come back in, how are you getting it in? You're having to fax that paper application in. You're having to wait in between each individual fax to get fax confirmation sheets so that if they say that they didn't get it, you have the time date stamp saying that you faxed it in at X time. That was something we were dealing with a ton back then. In 2015 or 16, we finally get CSG. CSG was where we could start to quote Medicare supplements. There was no Sunfire, there was no Connecture. We were able to quote Medicare supplements on there. Before we could quote Medicare supplements on some sort of digital actuary-backed interface like CSG, we were having to have a binder full of rate sheets. And if you didn't update your rate sheets because you didn't realize that the rates had changed mid-year, you were quoting people the wrong thing. You had to use these entire rate grids. We had document protectors with those rate grids in them for different carriers. We had the physical underwriting guides. If we needed to look up drugs in a formulary, we actually had the PDF and or the physical copy of the formulary to look up that drug. We had the same thing with doctors' networks. Now imagine how often Doctors Network changed now when we were just having to do Command F on the Mac on a PDF to find that doctor and see if they were in there. Even the carriers did not have accessible tools for that. Medicare.gov did not have provider search. Their drug plan interface for searching was much more restrictive. Even the compliance training has come a long way. Ask the people back in the day about Aetna No More forms, using No More forms to do certifications. Just such a pain in the arse, okay? 2020, when COVID happened, this really sped up the telesales revolution in MA. And of course, bad and good came out of that. A lot of bad actor call centers popped up over the next couple of years where it became too easy to do telesales. But there for a little bit, it was just a good thing because the same field applications we could submit before were now starting to be accepted over the phone because all of a sudden the government couldn't say, well, you can't do this over the phone, you need to go face to face. Okay, you want me to spread this, crazy coronavirus into people's houses? So it became kind of an oxymoron to push it that way. So it led to a lot of changes, which did have negative consequences and positive consequences. Positively, the Medicare Advantage market did grow, but negatively, it probably grew a lot of bad actor call centers that we're seeing purged right now. Yeah, so those were some of the things that I was trying to bring up to people about the history of AEP. There's a lot more nuance in there, but I think it's just important to understand that, just because Sunfire as a uniform enrollment tool, or Connecture or Health Sherpa as a uniform enrollment tool maybe has glitches, or maybe the drug plan formulary is not completely right. Just having a uniform place to submit applications for the majority of carriers and being able to do it over the phone is a huge step in the right direction. If I have to jump around and jump through hoops to find out if the formulary is correct, imagine doing that before and then still having to mail the paper application, wait to receive it in the mail, having to track through a log which ones that you had mailed out had still not come in, so you could call those people last minute and try to push them. That is the world we lived in, and we didn't know any better, so everything seemed fine. Even that seemed easy at the time. I had submitted 121 applications 1 week, doing it mostly that way. A lot of people I did have physically in person, so I was able to do some things that way. Some of it was MedSup or ancillary, which in some cases we were able to do over the phone. But a lot of the drug plans, Medicare Advantage plans, we were submitting by paper that way and having to mail them back, wait until the end of the day, and send them in. Even a lot of the paper applications for like United Healthcare Medicare supplement in person, I was still having to fax in at the end of the day. And then a lot of our business logs were done through like e-share files or e-boxes that we would have to access one at a time. And so when someone would open it and then they wouldn't close it, we'd have this shared file that they would have locked out, and you weren't able to update your business log, which was kind of like our version of a shareable, HIPAA compliant Excel document that we kind of counted like a CRM. But anyway, so I did walk 6 miles uphill in the snow, and I wanted to tell you guys about it. Many of you existed long before that. It's just good to have a little bit of awareness about how things have changed and how much better some things are. As much as people want to talk about the bad of what's happening with this, that, or the other, we see a lot of positive change, we see a lot of growth, and we see the industry getting easier to navigate in a ton of ways. Even when there are nuances that change, like variable commissions based on different types of products with different carriers that we maybe didn't see at the same rate as before. That's a nuance added, but there's been a lot of nuances cleared up. So that's it. AEP and Medicare enrollments style has changed immensely for the better, and we are here to make it even better for you guys and advocate for you. So if you have ideas, please comment them below, and we'll try to make those changes.